everyone. My name is Frederica Williams, and I'm the CEO of Whittier Street Health Center. For those of you who do not know me, we welcome all of you to this important neighborhood trauma teams meeting. Many thanks to Mayor Walsh, my good friend, Chief Arroyo, who's been a good friend to us, and the Boston Public Health Commission, including its Executive Director, Monica Valdez-Lupe, for being here today and for their commitment to improve trauma response and sustain trauma recovery services in the city of Boston. We also, I know there are many partners that invested in the trauma program, and I'm so glad to see Matt Fishman, Partners Healthcare, Boston Public Health Commission, Children's Hospital. Thanks to all of you. We're grateful to you and to Mayor Walsh and the City Health Department and the Boston Public Health Commission. We're grateful that you have engaged health centers to help to address this major public health issue and the impact of trauma on the physical. We see it on people who have diabetes and hypertension, mental and emotional health of the residents of Boston. The impact of trauma, as all of you know, are far-reaching, affecting victims, families, and in many cases, the entire community, and those of us who are caregivers as well. At Whittier, we have developed programs in partnership with community residents, Boston Public Schools, faith-based organizations, the Boston Public Health Commission, and other health centers to address youth violence through our REACH program, youth development programs, and outreach programs. We are educating and empowering our youth to be leaders in their community. We want our youth to reach their full potential and for our communities to be the healthiest, safer, and more productive communities. As we have expanded our work in trauma, thanks in part to the city's support, we at Whittier have seen the tremendous need here in our neighborhood of Roxbury. But we know this need exists in communities across the city. The community members we have been able to serve through these investments are suffering from trauma and all its effects, in many cases due to community violence, but often due to many other experiences with trauma in their lives. Trauma is not something that anyone, including the many impacted children we see, should have to face alone. We're fortunate to have all of your support. By enhancing health centers' ability to offer culturally competent behavioral health capacity right in the communities where people live, the city is acknowledging this public health issue and the impact on the well-being of Boston residents. Investing in trauma recovery also recognizes that trauma is not something that can be addressed in 1 hour, 1 day, or 1 week. It requires ongoing, sustained commitment. Once we as health centers engage community members in trauma recovery, we know they are counting on us to be there when they need us, whether it is tomorrow or many years from now. In addition, as the city has worked to improve the comprehensive trauma response in and across the city, we have embraced the new neighborhood trauma teams or NTT model and our partnership with our colleagues at the Madison Park Development Corporation. This represents a new kind of collaboration for us with a long-standing community partner. And we welcome the opportunity to leverage the strengths of each of our organizations and provide the best services possible. Our community wants to know that when a violent incident occurs, they can expect a consistent, professional response, and we are hopeful that the NTT model will make that a reality. Health centers are accustomed to tackling complex challenges, but trauma, with its complex causes, effects, and solutions, is one of the toughest of all. We don't shy away from challenges. We embrace the challenge because when we see a need in our community, we step up and seek to tackle it. To be successful, we need all of your support. On behalf of my health center colleagues, we would like to extend deep gratitude to you, Mayor Walsh, for the opportunity given to us to be a part of this wonderful team to contribute to our patients and the communities. We will continue to approach our work with a spirit of openness and a deep sense of compassion and respect for those we serve. Thank you for the opportunity and thank you for the investment. It is now my pleasure to invite our Mayor, Mayor Mattie Walsh, to the podium. Thank you.
Thank you, Felix. Okay, I bring Felix up. All right, thank you, Frederica, and thank you everyone here at Whittier Street for your great work. I also want to thank a few people that are here. Chief Felix Arroyo, who's going to come up in a few minutes, who's been working on this issue with us for the last 2.5, almost 3 years. Monica Valdez-Lupe, our Executive Director. We have Commissioner Will Morales here from Boston Center for Youth and Families. Commissioner Billy Evans is here from the Boston Police Department. Chief Hooley is here from EMS. We have Frank Doyle, two roles today, but the chair of our Public Health Board. I know that District Attorney Dan Conley is coming. Oh, he's right here, sorry, District Attorney Conley, who we're going to have come up and say a few words in a few minutes. I know they were grabbing you out front, all the press, so I snuck right by them. He's coming, I just went right upstairs. I want to thank you, and I want to thank all the community partners that are here today for your involvement in being here this morning. The providers, thank you as well for all the work you've done in our city over the years. Trauma has many causes, and it certainly has many impacts. When it's untreated, it holds people back. And when it's concentrated in certain parts of our city, it can hold the entire neighborhood back. And we know how powerful the cycle of violence can be. And today we're announcing new neighborhood trauma teams that are going to be working in the city of Boston. Before I get into the trauma teams, two things I want to talk about. One was when I was a candidate for mayor, when we were all candidates for mayor, I think it was after the primary, there was a young man shot in Uplands Corner. Actually, no, it was before the primary. There was a young man shot in Uplands Corner, and two people that worked in the campaign with me knew this young man. And I went to the house of the family where the young man was shot, and I walked in, and his girlfriend was in the room crying in the bed, and his mom was there, and the family. And I sat on the curb because I was trying to comfort one of the young people working on the campaign with me. And I sat there and I watched how trauma takes effect. I saw a bunch of young men that lived in the neighborhood that were pissed off and angry. And they wanted to respond, you could tell, and the response wasn't to go over and have a conversation. The response was to go back and react to violence. And then I saw young people walking into the house crying that didn't have anybody kind of watching them. And I was watching this trauma go on. I thought to myself that right here is a perfect situation that if we had counselors to be able to go down and talk to the family, we could talk to the family members, we could talk to their friends, we could talk to, and also somewhere else in the city, there was a person who did a shooting that they were going through the same type of trauma because it was usually in retaliation to something that happened earlier. That happened the other night, right not too far from this front door here. Across the way here where a young man got shot. And what we're trying to do with these neighborhood trauma teams is make it easier for us to go in and do the work we need to do. Now, we have great partners in this room, and I want to, when I commended them, I want to commend the street workers that are here. I want to commend Commissioner Evans that's here. I want to commend Dan Conley that's here. We had Dan Conley had a basketball tournament the other day over at UMass to talk about peace. But what we really have to do is focus on working with our partners to make sure it's easier to coordinate immediate responses and long-term recovery services in the city of Boston. We're going to build upon the continuum of care. We designed our neighborhood trauma teams by working directly with communities they serve, so people in the neighborhoods know exactly what those neighborhood needs are and what those changes might be from neighborhood to neighborhood. And the community input has guided us every single step of the way, and I want to thank the community for that. We've invited residents to listening sessions all over the city. We heard from more than 350 people in Roxbury, Dorchester, Mattapan, Jamaica Plain, East Boston, including youth and parents. So this is not an idea that was come up by myself, Monica, and Felix sitting in a room. It actually comes from the community. And I think that one of the things that people said in the past is that we don't listen to the community. Well, in this plan, we are listening to the community. because this plan has been designed by the community along with our providers. We've heard what's needed in the aftermath of a traumatic event, and the input that directly shaped this program is part of that. Each neighborhood trauma team will be co-led by a local community leader, a health center, and a community partner. So I want to thank the health centers, who are vital in our community in so many different ways. Our community partners, which are different, they change in different neighborhoods. Thank you as well, community partners, for stepping up. We need to make sure that we're meeting the specific needs of each neighborhood. And we need to make sure that we help to make these continuum of cares more seamless. In some neighborhoods, we have cultural issues. We have folks from a different background, say Irish, that will stick together and won't talk to each other. We have to treat that differently than we might be treating something on Molina Cass Boulevard, which we might be treating something a little different than we're treating in Blue Hill Ave in Mattapan. And the community understands that, and the health centers understand that, and the people that sat at the table with us understand that. We've come a long way in trauma treatment in Boston. Since 2012, the Boston Public Health Commission has trained over 120 clinical staff all across our city. In 2013, the Public Health provided trauma awareness training to more than 2,500 frontline staff working community-based organizations. This new program is going to build on that momentum and leverage the strong networks of partnerships that have been built. Healing is crucial to breaking the cycle of violence. That's probably the most important thing I'll say today. We need to make sure that we continue to heal. It's important for us that we work hand in hand with each other in efforts to expand the opportunity to prevent violence. We need to invest in early education. We need to invest in job training. We need to invest in housing. We need to continue to work with the district attorney. We need to continue to work with the sheriff's department. We need to continue to work all together as one team. We might have disagreements along the way, but at the end of the day, it's about reducing the numbers, making our neighborhoods safer. And I know one thing, that this work that we're doing will pay off. What's happening in the city of Boston now, violent crime is down. So are the number of arrests that we have in the city. Over the last 3 years, we're down nearly 40% in arrests. We're on the right track. But as the commissioner has said, and I've said more than one time, one violent event is one too many. One person struggling with the effects of trauma is one too many. There is still work to be done, and we're just getting started. Together, we can break the cycle of violence. We can help families heal. We can make sure that all Bostonians are thriving. This has been an exciting partnership between the city, community organizations, and the neighborhood health centers. I want to thank you all again for your hard work. I want to thank you for what you've done here. As I look around this room, many of you are in different rooms for different issues around the city of Boston. But this is one area that we can make a tremendous impact on violence in our city, to reduce the numbers of violence in our city. I want to thank the organizations who are in this room that have done this work for a long time. We're here to help you. That's why we're here today. Now I'd like to introduce the Chief of Health and Human Services, Phil Chirollo.
Good afternoon, everybody.
Good afternoon.
First, let me just give a special shout out to the health center we're in, the Whittier Street Health Center. I think the Whittier Street, on more than one occasion, in fact, most occasions, is really leading the way on what community health looks like. You know, I was lucky enough to have gotten to know Federica over time, and I knew what it was when she showed up, and I know what it is today, and it has been nothing but growth. It has been nothing but just every day, the impact of this health center is felt across our city, and every day it's felt more and more. And while Federica, as the leader, deserves a tremendous amount of credit, she knows, and she expresses to me all the time, that it's not just her, but it's all the many, many people who work here and the many who support Whittier. And I just want to give a shout out to Federica, her team, and all who support the work that we do here. I want to give a shout out to our mayor, who you just heard from, who every now and then reminds people that I had the silly idea of being mayor at the same time that he did. We call those the days we don't speak about, except he brings it up all the time. and it gets in my way of asking for vacation time. But I'll say that one of the reasons what attracted me to candidate Walsh, then State Representative Walsh, and what makes it real easy for me to say that I work for Mayor Walsh is that he's a man with a huge heart, a big heart. In fact, some people around him will say his heart gets him into trouble. He'll do whatever it takes to help people. And when he meets families and he deals with mothers who are burying their children, going through the most unnatural of life experiences, which is you burying your child as opposed to your child burying you, it impacts him. It impacts him in the way you want it to impact a leader. And so what did he do? He told Monica, but I want to shout out a couple leaders in the city. He told Dan Mulhern at the Public Safety Initiative. He told Billy Evans at our police department. He told Will Morales out of East Ref with the street workers, and he said, we have got to figure out a way to do better around dealing with folks when the unthinkable happens in their life. First, with our street workers, with our police, with our community partners, work real hard to make sure the unthinkable doesn't happen. But inevitably it will. And when it does, they're a part of our community. They're our family too. We have got to go back to them and let them know that what happened was unacceptable and we're not going to make you go through this alone. And so that was the genesis of this. What did the Health Commission do? They led that effort working with all these different departments in the city. But we knew, as the mayor said, the best ideas are not ideas that have come up in some 8th floor office building at City Hall, but in fact are ideas when you listen to the community who are going through those traumatic events and have that experience. That's what the community process looked like. Hundreds of Bostonians had input on what this would look like. And what does it look like? It looks like our vital component of our healthcare delivery system here in Boston, what makes Boston really the best place to be for healthcare, because you have our major hospitals, right, and our research hospitals. Then on top of that, you have something that most cities cannot claim to have, which is these 23 amazing health centers that do community health right in the neighborhoods. And we said, we need the health centers to play a role as a community health partner, but we need a CBO, a community-based organization, to be the one on the ground who gets there when something goes wrong. That's what's happening here. It's a tremendous experiment. I can't think of another city that does it this way. And we believe we'll be successful because of the role community played in putting it together. And we think, once again, Boston's going to lead the way on how to behave when there's a traumatic event, right? That's what makes this so exciting for me. I want to talk a little bit about just me personally, and it hit me while I was sitting here, and it's hit me every now and then. You know, when I was in 8th grade, a very close friend of mine was murdered. I was in the exam schools. I thought I was doing all right. You know, trouble for me was maybe stealing a bubblegum packet from the school, right? It was nothing very major. If my dad were here, he'd be embarrassed that I even told you I did that. But when Joshua was murdered, I didn't really know how to deal with it. I remember lying to my dad about when the funeral was because I didn't want to see him in the casket. And so at the last second, my dad found out what it was, and we drove there, but I got my way. I got there too late, so I didn't see him. I also forced him to not let me go to the burial ground. So I have never been, to this day, to where they put Joshua on the ground. It's easier for me to pretend he moved away. As a 38-year-old man, I still pretend he moved away. But it led to things in my life. It led to me messing up in school. I ended up going from being a great student to being not welcomed in the school that I was in. It led to me moving to another school, getting into many fights. I didn't really relate that it was related to Joshua's passing, but it was. This would have been amazing for me then. It would have been great for my family to know that they didn't have to go through it alone. It would have been great to know what that meant, not going through it alone, looks like. It would have been great to have a place where their child can go. Now, you know, my life has gotten better and it's changed, and clearly you can see that from where I'm at. But I think I might be an exception to that story. I think there are many out there dealing with trauma in their lives who haven't known and don't know that there is help. So if the one thing I'm going to say here, very loud, and one of the things that is important for Mayor Walsh and everyone who works for Mayor Walsh to say out loud wherever we go is, you're not alone. You are not alone. We do indeed care about you. In fact, we love you. We know that you're a part of this city. You're our family as well. You are not alone. There's now a hotline people can call when they're going through traumatic events, and we hope that we will be there when it happens. Sadly, it may happen, but when it does, you can count on us. And that's what really, in the end, Mayor Walsh and the Health Commission and others are trying to do with this program. And I hope that we're actualizing our values, and I hope that all of you out there see that. And when you see something not working as well as it should, let us know. When you see something working really well, let us know. We want to make this program a huge success. With that, allow me to bring up our district attorney, someone who I know gives to the community in ways beyond just being elected district attorney, because we've actually coached baseball together, where he was coaching the team from his neighborhood, I was coaching the team from my neighborhood. My team won. It is baseball, and I had all the Latinos. We weren't doing hockey. But with that, let me bring up a good friend of mine, District Attorney Dan Conley.
Thank you very much, Felix. I appreciate that reminder. As I actually told the officer that drove us here this morning that story, as a matter of fact, and all the boys that I coached were from West Roxbury, and all the boys, obviously, that Felix coached were almost exclusively from JP, but maybe some from Roxbury too in the South End. And as he said, all his boys were Latinos. All mine were Irish or Italians, right? But it was, what a wonderful opportunity right here in this field here to play against each other and to compete and to leave that field as friends. So that was a great experience for the kids that I coached, and I think for Felix's kids as well. And yeah, he won, but it was only by 1 run, I think. So it was a really close game.
Winning's winning, man.
Yeah. I know, you're right, as we know. Yeah, exactly. That's right. Well, I've said this before. After the election for mayor, hi Frederica, doing a great job here. No, after the election for mayor, you know, we got about, what, 90 feet of snow that winter, and I was having a cup of tea with my wife. Courts were closed for the day, and Marty was up there talking about the 90,000 plows that were out there and what they were going to do with the snow, and I said to my wife, Tricia, aren't you glad he's our mayor? And she was thrilled. But you haven't changed at all. He looks exactly the same as he did during that race. I know I've gotten a lot grayer. Felix, you had a little more hair back in the campaign, but we had a great campaign because it was all about issues and we remained friends. And the only complaint I have, why didn't you offer me a job? All right. But anyways, thank you. As soon as, on the campaign trail as well, in 2013, and as soon as he took office after being elected mayor, Marty Walsh made clear his commitment to addressing the needs of our communities impacted by trauma and violence. He reiterated that commitment during last year's State of the City address, piquing the interest of many of us here in the city, including myself, when he announced his intention to take that commitment even further by working with residents, police, and public health officials to address the need for more and better coordinated trauma services in the wake of violence. Today is the fulfillment of that promise. Every act of violence is like a stone tossed in a pond. You know, I'll just digress from my prepared remarks to talk briefly about the incident across the street last week. Lots of young people were present or nearby when that happened. Residents were living in those units when that happened. It's very obvious, it should be to all of us, how that whole community was terribly traumatized by that singular event. The ripples from a single violent act go far beyond the victim and the perpetrator, radiating outward to their families, their neighborhoods, and their communities, deeply affecting even total strangers. Those ripples of trauma can infiltrate every aspect of life, including health, education, relationships, and the social fabric that connects us as friends and neighbors. And tragically, the impact is felt most acutely by young people, the kids and teens who by all rights should be the most insulated from it. It's my deepest hope that we will now see ripples of a different kind from the work of the program that the mayor is announcing today, Neighborhood Trauma Teams. By strengthening the immediate response to acts of violence, as well as longer-term follow-up, we can help stop the cycle of violence in our neighborhoods and the physical and emotional harm that result from it. Trauma response requires a collaborative approach, and this project delivers it. Beginning with the hundreds of community members who offered input about the needs faced in the neighborhoods, Mayor Walsh and Secretary, is it, what's your title, Felix? I'm sorry. Just Felix. Chief, I'm sorry. Chief Felix Arroyo and the Boston Health Commission have built a strong coalition of partners across the healthscape to ensure the success of neighborhood trauma teams. Boston Children's Hospital, Partners Healthcare, Justice Resource Institute's SMART team are all valued partners in our efforts to address violence and trauma across the city, and the involvement of neighborhood-based health centers and nonprofits will be critical to reaching community members in their own neighborhoods and homes. Everyone in Boston deserves to feel safe in their homes and in their neighborhoods. Children deserve the opportunity to grow up with a sense of security and the ability to learn and grow without fear. In those areas most impacted by violence, however, residents are too often denied the opportunity to thrive because of the weight of the trauma that they carry with them. The needs of victims of violence and those impacted by violent crime, both directly and indirectly, must be addressed in order to break the cycle of violence and adequately address the needs of the communities most impacted by it. Survivors' voices need to be heard. No one agency can reach the goals that this initiative has set out to achieve. But together, this coalition of city agencies, local health centers, and community partners has the ability to make a positive and lasting impact in our neighborhoods. The impact of the work beginning here today won't just be found in crime statistics. It will be measured in the improved health of neighborhood residents, in greater community engagement, and in the future success of children growing up in every corner of our city. The creation of these trauma teams is a strong response from Mayor Walsh and the Boston Health Commission to the community and their request for trauma services. It's part of a larger strategy, a comprehensive, evidence-based approach to safer neighborhoods. An approach that prioritizes the well-being of residents, both before and after an incident, by recognizing their immediate needs and ensuring a sustained response. This means violence prevention up front and afterward, with efforts to intervene and a focus on healing throughout. The time and investment, both in terms of dollars and listening, are truly impressive, and I applaud Mayor Walsh for what he's doing here. I would like to commend each of our community partners and healthcare partners who have invested so much of their time and resources and offered their expertise to ensure the success of this initiative. Together, we have an opportunity to stop the cycle of senseless violence that feeds trauma and despair for too many in our communities and leads only to more acts of violence. We can create what the late Robert Kennedy called ripples of hope, crossing each other from countless different centers, creating currents strong enough to break down walls. The Neighborhood Trauma Team program is a powerful means to that end, and I'm very grateful to Mayor Walsh for launching it today. Thank you very much.
Good morning, everyone. My name is Monica Valdez-Lupi, and I'm the Executive Director at the Boston Public Health Commission. These are really tough acts to follow, and I can't say that I've been part of this elite club that was running for mayor three years ago. But maybe, Frederica, is it too late for us, maybe? Maybe we should throw our hats in the ring. But in all seriousness, I want to thank Mayor Walsh, Chief Arroyo, District Attorney Conley for your remarks. And I want to thank all of our partners in the room this morning, and also Mayor has already highlighted many of the folks in the cabinet, different cabinets and the different departments that we work with. But just by his setup, I think it's a reflection in the way that you lead, in the way that you push us to cross our departmental lines and to work collaboratively and to think creatively about how to work together on an issue that the city has grappled with for many years. And so I want to thank Commissioner Morales from Boston Center for Youth and Families, Commissioner Evans from the Police Department, Andrea Amador, who serves as the Assistant Director of the Behavioral Health Services at Boston Public Schools, JRI and the SMART team, Boston Medical Center, Brigham and Women's Hospital, and our grantees, which include many of our community partners in the health centers who are here. And I also want to recognize and thank Children's Hospital Boston and Partners Healthcare System for the support that you've offered to us in this new phase of our work on the neighborhood trauma teams, because you've been able to help us realize this vision of bridging our community-based response with longer-term recovery services. So thank you for your support and your guidance in this work. And I want to thank all of you again for joining us, because we really do think that this is an innovative, new initiative and one that will be a model to other cities around the nation that are combating this epidemic of violence in our neighborhoods, in our urban centers. As I was riding over here this morning, I was talking with a friend, and it was a reminder of why we do our work at the Commission and why we do this work at the Health Department. And the Mayor and DA Conley have talked about the recent events. But this friend in the ride over reminded me that her son's passing is nearing 20 years this fall. And when she was talking about the pain she experienced, she said it was like losing a limb. You get used to having, not having an arm or a leg or a hand, but you always miss it, and you always feel like it's there, and it's something that you look for. And so her words and the events that we've seen in the city over the last few days give us another sense of urgency and a reminder of why this work is so critical for us and the importance of the work that we do to help not only support individuals but entire communities that are confronting the violence that we see. And you've already heard that violence affects all of us. And it has a really profound effect in those communities across our city who are chronically exposed to violence. We know from research that there's a pathway from traumatic experience to psychological stress, and from repeated psychological stress to long-term physical and mental health outcomes. The research also suggests and is validated by what we know, that even witnessing violence, and Chief Arroyo talked about this, can put an individual, a child, a teen, or an adult on that pathway. And this means that violence doesn't just affect that individual person, that victim, his or her families, or their friends. Again, it affects entire neighborhoods. And experts have described this violence as being like a contagious disease, which can incubate and spread throughout communities. The communities that are constantly exposed to violence in the city are those same neighborhoods that are disproportionately impacted by racism, poverty, social distress, and many of the health disparities that we see in our clients. Families in our communities are acutely aware of these burdens, and data from a survey that we did in 2013 with over 2,000 Boston parents and caregivers, the Health of Boston's Children's Report, finds that approximately 26% of our parents and caregivers felt that their child was unsafe in the neighborhood, 1 in 4 across the city. And when we look at this percentage, when we asked our parents and caregivers in Roxbury and Dorchester, the numbers increased to 32 to 37%. In public health, we believe that prevention is always the best option, and it's the key to breaking this cycle of violence. And the neighborhood trauma teams are all about prevention and healing. Our teams will be there for the community when an incident occurs to respond to the resulting stress, and they'll be there for the affected families and individuals in the community by offering not only immediate support and easy access to ongoing trauma support services, but they'll also be there to help them navigate and also mitigate the longer-term impacts of exposure to trauma. This work builds on the expertise of many people in this room and many people who weren't able to join us this morning. And so I want to thank all of you for your ongoing guidance and your commitment and support to working us in this next phase of the project. As the mayor said, when I joined the commission last year, he spoke with me in those first couple weeks and shared that he was very interested in building on this first phase of our trauma activities at the health department by tying with it a community-based response strategy that would be coupled with the behavioral health services and other recovery services that were offered by our health centers. We not only met with our community members, but we also met with our providers in the health centers, and we gathered their feedback, their ideas for strengthening the collaborations, and we worked through some of the challenges that they thought they would encounter in trying and piloting this new experiment in working with a community-based partner. So the mayor's already talked about the scope of the work that the neighborhood trauma teams are providing, so I won't go into that. But when I think of what the community was telling us what they needed and what we've designed with the hopes of being responsive, there are 3 words that I shared in our listening sessions and conversations over the last year. That the new models that we would design would be continuous, consistent, and culturally competent. Violence and the impact of trauma are really complex issues. No one agency, the health department, can't do this alone. And the funding and support for these new neighborhood teams is a step in the right direction towards building a trauma-informed city that can work together across our different silos and with our community partners to break the cycle of violence. I want to acknowledge one of our colleagues at the Commission who wasn't able to join us today, Courtney Gray. Many of you have worked with Courtney. I knew Courtney before he even began working at the Commission when I was there in 2001, and he's working with Dr. John Rich in our men's health clinic. And Courtney has really helped pave the way for our trauma work that we have at the Commission. And he's been with us along the way as we've been re-engineering and redesigning the work. And Courtney, I wanted to share with all of you, if you hadn't heard, has assumed a new leadership role at the Commission, working on disaster behavioral health with our preparedness unit. But I want to thank Courtney because he has been leading much of this work with us and with the mayor. I want to invite, at this point, our trauma teams from Dorchester, East Boston, Jamaica Plain, Mattapan, and Roxbury to the front. So I think I see some of you in the audience. And actually, as we're all assembling, I'm not going to, this represents most of our trauma teams and staff. And I wanted to point out, I know that Reverend Scott has got his gear on, so Reverend Scott, if you want to stay up front, so we can show everyone that this was something that when the mayor asked us to think about the work differently and make sure that we were recognizable, so when we were responding to an event, people in the neighborhoods knew who we were and that we were part of the mayor's team. We took our teams to task, Mayor. And so we worked with our partners here to help design the logo and to come up with the pamphlets and materials and the brochures that you've been seeing cycling on the screen. And wanted to make sure that you saw this because we're hoping that the teams, the gear that they'll be working, and honestly the work that they'll be doing will become a symbol of trust and continuous support that they're going to, that they're not only going to expect, but they're going to get from the health department and across our teams. And so again, want to thank Mayor Walsh, Chief Arroyo, DA Conley, all of our partners who have joined us here today, and thank all of our teams for going on this next phase of the journey with us, and really excited about these opportunities to work with each of the health centers and the community-based partners. So thank you, everyone.
Thank you again to all of you. Thank you again to all of you, and thank you, Mayor Walsh, for your vision of a healthy and safer community. As Monica has mentioned, we're up to the task. We work with many of these community-based organizations and hospital partners, and so this is an opportunity for us to fulfill your vision for Boston. Many of us are Boston residents too, so this is personal to all of us as well. So as caregivers, as residents, as parents, we are also raising Go See 'em.
Go see him.
Go see 'em. So we have a little thing. We may not have run for office, but Catholic Memorial, for those of you who don't know the little Go See 'em. And Frank Doyle, Go See 'em. So thanks to all of you for being here, and for we have a wonderful partnership with the Boston Police Department. They've been very supportive of all of our youth programs. We believe, as Monica said, that this is a model. Boston is a city of leaders. Boston is a city of visionaries. We will be leading the way, and we will be measuring our impact, and we'll be able to share our stories. So thanks to all of our community residents for all of your input, all of our community partners for all of your valued input, and thanks to all of you for visiting my house, our home. Our staff are wonderful and love hosting people. I had to tell them this isn't for invited guests only, because all of them would be here because they want to share their stories with you. Have a great day. Thank you.